Let's talk about the laboratory testing for disorders of primary hemostasis. And remember, primary hemostasis may affect von Willebrand factor, platelets, or the blood vessels. For this section, there's not really any laboratory tests that we can use to assess blood vessels, and we'll talk about von Willebrand factor later. So let's focus on the platelets. There are three main tests that are used to analyze platelet function, and I'll let you know about a fourth that's not really widely used. So the first is a platelet count, which I alluded to earlier. Platelet counts can be either automated, run through a machine, or manual, where somebody looks through a microscope and counts the number of platelets on a slide and multiplies that by a certain amount. Platelet counts will just reveal an increase or decrease in the number of platelets. It won't tell us anything about the function of those platelets. We can also get a sense of the shape and size of the platelets. Those may be abnormal in specific diseases of hemostasis. As I mentioned in the last video, the platelet count is often included in the complete blood count. And the typical platelet count in the body is between 140,000 and 400,000 platelets per microliter of blood. The platelet count tends to need to be very low before spontaneous bleeding will take place. Very low tends to be below 10 to 20,000 platelets per microliter. The next test is the bleeding time. Bleeding time is not really used very often anymore, and that's because the bleeding time is a test where a small injury is inflicted upon a patient, and you literally are timing how long it takes for blood to stop being lost. Since von Willebrand factor is also needed to form the platelet plug, deficiencies in von Willebrand factor or abnormal number or function of platelets can lead to a prolonged bleeding time. This test has been widely replaced by the PFA 100. So what is the PFA 100? Well, that's the next test. PFA is a platelet function analysis, or platelet function analyzer. And unlike the bleeding time, the PFA 100 is performed in the laboratory using a sample of the patient's blood. The PFA 100 will be abnormal with platelet dysfunction. Finally, platelet aggregation studies are sometimes used to delineate what the specific cause of the patient's primary disorder of primary hemostasis may be. Those are the least commonly used and the most highly specialized. So once you've determined that somebody has an abnormality in their platelet function, then a hematologist would probably order platelet aggregation studies to find out what the actual defect is. To summarize, by far, the most common test you'll be ordering to assess hemostatic function is a platelet count or CBC. Then, if you still suspect a disorder of platelet function, then a PFA 100 would be the next test to consider ordering.